All right. About the MRCS OSCE, we are going to share or we are going to mention whatever you need to have a complete preparation for yourself. Okay. First of all, to all of you who have completed the MRCS Part A successfully, so many congratulations to all of you. And this is just the peak of an iceberg. So many more things you need to cover up. Okay. So that is my goal. You guys should have gone for all of those things so that it will become a little bit easier for all of you to understand the concept of this exam and how can we prepare ourselves. Okay. So what is the basic objectives that we're going to learn tonight or what you will achieve after this session, right? So the first thing is we are going to talk about the basic introduction of the exam and the formats, and then we're going to go through a station background. We will go through a little bit of scoring system of the exam, and we are going to talk about a little bit of the exam venues and also how much cost you need, what are the study materials you need, what is the preparation time you need. And finally, I'll mention some of the tips to or some strategies through which you can crack the exam very easily. We are going to talk about our courses as well. And of course, the most essential one is to have a proper question and answer session where you can have the questions. I know you will have the questions in your mind, right? So you can ask me, no problem. And I'm going to give you the answers. Okay. So the perspectives are like after each segment, also you can ask the questions if you don't get those things clearly. Okay. Am I clear till now to all of you?
Yes.
Perfect.
Yes.
And in between, please, you need to have communicate very well with me. Otherwise, I will not understand whether you guys are understanding or not. Okay. So this is basically a two-way of communication that should happen in between you and me. Right? So first of all, about
Yes.
the introduction, like all of us know, this is a the MRCS. Basically, this is the intercollegiate MRCS Part B OSCE. This is the second and the final examination that is required to gain the membership of the Royal College of Surgeons, right? And you can have this from England, Glasgow, Edinburgh, or Ireland, right? So I think you all of you know about these simple things, correct? So um, well, you have given the MRCS part as a written paper, right? So the part B is basically the OSCE or which we call like objective structured clinical exam, which is a little bit of similar to the practical OSCE exam that we have given in our medical school finals, right? There are some series of station in the circuit around which we rotated. Remember, guys? Yeah. So this is basically that kind of exam that you are going to give in case of this Part B or OSCE exam. Also, we know the eligibility criteria, right? All the candidates must pass the Part A before they can take the Part B. Okay. And in order to be an eligible candidate for MRCS OSCE, you must have a medical degree, right? And that should be accepted by the GMC, the UK GMC, that is the General Medical Council, or the Medical Council in the Ireland, right? So that you can have a fully provisional or temporary registered certificates with you before you're going to book for your exam, right? And no matter what, from which colleges you have passed your Part A, maybe you have passed from Glasgow or Ireland or Edinburgh or England. Okay, so you can take your exam in any of those four colleges. There will be no problem with those things. Okay, now candidates have only four attempts in which you need to pass your MRCS Part B OSCE exam within a 7 years of given time. All right. So about the introduction and the eligible criteria, you can go through these things. Like there are lots of information that I have given, and particularly for the past 2.5 years, I'm just teaching. So I have gathered some very important information for all of you, so that you guys have the important information and you can crack it very easily. So if you guys want to take a screenshot, or you can ask me to share this PDF with you afterwards this session, I will be love to give this PDF into our drive so that you guys can have the important information if you need to look at those things as well. Okay. About the station, if we are going to break it down, normally this OSCE exam has 17 examined stations that you need to face. Okay. Now, always remember about the timing. Timing is very important in this case. All right. All of this station that has been divided into subcategories, like we have the knowledge and we have the skills, right? So like with the knowledge and the skills together, we have a total of 17 stations. All right, we can have some of the rest stations, or we can have some preparatory stations. We are going to discuss about those. I'm going to make sure that you guys know about those things as well. So in general, about the timing, each of the station will have a 9 minutes. Okay, that means for the 9 minutes you are going to perform. All right, then you will be given as a one additional minute for reading an instruction. Suppose, like, see, the images that I have given here. Suppose this is a hospital corridor where you are going to give your exam, right? So before you start your exam, everyone will be, like, standing like this. So this is the your station doors, right? So over the station door or over here, there will be a stem will be stuck over the wall or over this door. Okay, so the 1 minute that will be given to read the instructions that is given over the door or over the wall, right? Before that, all of you will be standing like this. Okay, now within the 1 minute you are going to read the stem. What does it mean by the stem? The stem means the some of the information that is given for the specific station that you are going to perform within this station. The information, like how you're going to do those things, particular things, like maybe it's an anatomical station or skill station for the clinical examination or something like that. So you will have the instructions, proper instructions here, what you're going to do after entering into the station, right? So 1 minute is given for reading this stem. Okay, suppose you have entered this station, right? I will be showing some of the images that will be looking alike a real exam. Okay, and remember all the images that I have given here. Um, all the images has been tailored to this specific orientation class from using an AI, and particularly tailored for our MRCS OSCE exam. And that has been, I have done this just only for you to, so that you guys can understand. Okay. All right. So after you have entered into the station, you are going to have 9 minutes. That means 9 minutes you are going to perform, right? For the 9 minutes. 1 minute that has been given for reading the instructions, or that we are calling the stem. And then after the finishing of your station, for your movement, that means you have come out from this particular station and then you will be going like this, and this person will go into here. This person is going to go here, right? So basically, there will be a clockwise rotation. There is a clockwise rotation of each of those candidates, right? So for the movement, you are going to have 1 minute. So total is basically 11 minutes we are going to have for each of those stations. Till now, everyone, is it clear or not?
Yes, sir.
Clear. Yes, yes, bhaiya, clear.
Perfect. Any queries or any questions till now?
No, bhaiya.
Everyone? Perfect. All right. So as a total of time, we can think this will take about 3.5 hours to complete all of your station. Okay. And as this is a long exam, right? So you are going to given like suppose you have given 9 stations, and then you will be given a rest for maybe 10 to 15 minutes, depends upon the centers. And then again, another circuit will start. Okay. In between each of the stations, suppose this is station one, this is two, this is three, this is four, or something like that. So after maybe 3 or 4 station or 4 or 5 station, there will be a rest station. What does it mean by a rest station, right? So the rest station means you'll be given the same time of 9 minutes, 1 minute to read the stem, but there will be no stem. So, and also 1 minute to move. That means you are going to get exactly 11 minutes in case of the rest station as well. What you're going to do with the rest station? Any idea, everyone?
No.
Open question. What you're going to do with the rest station? Anything?
We will
Sir,
get rest.
is this the
Just rest and
preparatory
enjoy the
station?
exercise.
No, there is a rest station. Okay, so in the rest station, you don't have to do anything. Okay, there is no
Just
stem.
relax.
There is no yes for the relax. Okay, so any other thing, any other suggestion? One person said you are going to be relaxed. Okay, perfect. But like any other suggestion? All
Drinking
right,
sips of water.
all right. Like everywhere there is a table, and over the table there is a water bottle. Everywhere is there. You can drink whenever you like you are in a corridor or in a bay. Okay, you can drink. There is a lots of drinking bottles will be there. No issues with that, right? But you cannot drink or eat inside of the exam station. Otherwise, you can drink, no problem. So what we are going to do in the rest station is basically we are going to use the restroom. Okay, trust me, this will help you immensely because we will be in so much stressed. Okay, our bladder will be full. Okay, so we need to release those. Whenever you get to know this is a rest station, just hit the restroom. Okay, you become very much relaxed, forget about whatever you have done, and just prepare for the next station. Okay, that's what we are going to do with the rest station. All right. So about the station breakdown, I hope it is a little bit clear for all of you, I guess. Yeah. How many stations we have to face? Everyone? Total of 17 stations. Perfect.
17 stations.
What is the
17.
time breakdown? What is the time breakdown? 1 minute to
9 minutes.
read the stem or instructions, 9 minutes for our performance itself, 1 minute for our movement. So total of 11 minutes. Is it clear?
Yes.
Perfect. All right. So let's break down a little bit more, okay? And then we are going to talk about the scoring system. All right. So as I have mentioned, the total 17 station has been further subdivided into two basic categories, right? One is knowledge and another one is the skill part. Okay. In the knowledge, they have given 8 stations, okay? Among them, we have anatomy, that will be included as a 3 stations. There is another one that is applied surgical science and critical care. This will include 3 stations as well. And there is one pathology station. This will include 2 stations. This is about the knowledge. How many stations are there? Total 8 stations. Remember, you need to pass the knowledge and the skills separately. Okay. So always remember from now on till you are going to give your exam, always remember here the anatomy and the critical care stations are the key to pass the knowledge. Okay. Why? I will mention those during our class time. So, right? Anatomy and the critical care stations are the key to pass your exam in case of the knowledge. All right. Let's talk about the skill part. In the skill part, there are 4 subcategories. Okay, there are a total of 9 stations, and the subcategories are you need to do a clinical examinations that will include 3 stations. There will be 2 history-taking stations, 2 procedural skills stations, and 2 communication stations. All right. Now, here, which one is the key? Of course, our clinical examination is the key to pass our skill part. Why I'm mentioning? Because there are 3 stations. So naturally, this will carry more marks, right? So, and in other things, the communication and the procedural skills, these are very easy. So to key or you are going to emphasize in the clinical examination and mostly the history taking, that will be your key to pass the skill part. Till now, any queries, any questions? Knowledge, how many stations total? Everyone, please reply.
17 stations.
No,
8
no, bhaiya.
stations.
Eight
In knowledge,
stations.
8 stations.
8
8 sta-
How that
80
that has been
stations.
further subdivided? Anatomy,
Anatomy 3.
perfect.
Applied surgical science
Applied
and clinical care
surgical
3
science.
station.
3 stations and patho, two
Pathology
stations.
2
Perfect.
pathology.
station.
Skill part, how many total stations are there?
There are 9
Nine
stations
stations.
9 stations. How they are
and
subdivided? Clinical
they
examination,
Clinical
are divided
examination.
into physical examination
PVD.
in the 3 station, history taking
right?
are 2
Two
station,
2.
stations.
procedure is 2 station,
Two,
and the communication
communication,
station are 2.
Two
perfect. All
stations.
right,
2
right.
station.
Okay. Now, about the communication station. there are basically two types of stations you're going to face that we're going to talk. Okay. Now, I have talked about the main station, I have talked about the rest station, but there is another type of station that you are going to face or encounter just before the communication station. Okay. That is called preparatory
Preparatory
station.
station.
Okay. What does it mean by the preparatory station that we are going to discuss? So just remember for now, you are going to have two extra preparatory stations just before each of the communication station. Is that clear?
Yes.
Yes, sir.
Perfect. All right. So remember, I have mentioned about the preparatory station, but I'm going to discuss those things later on. Let's talk about the scoring system. Okay. Now, in case of our OSCE exam, each of the station will carry 20 marks. Okay. Now, as I had mentioned, we have total 8 applied knowledge stations, which included the anatomy, pathology, and the critical care that will be given as a 160 marks. Okay. That is the full mark. And in case of the skills, there were a total of 9 stations. So that means we are going to have a total of 180 marks, right? Now let's bring it down a little bit more. So in case of the knowledge, as you can see, particularly, mostly, we have the anatomy 1, 2, and 3. How many stations? I have mentioned 3 stations, right? And this anatomy and the pathology, these 2 stations are purely knowledge. Purely knowledge, okay? So you can see the total mark will be given as per the knowledge you are going to share, as you are going to deliver to the examiner, right? So purely you are going to have the 20 marks if you are a very much knowledgeable person. But from now on, after this, when it will comes to the critical care, you will be the total score will be subdivided into further categories. Okay. So of course you need to be knowledgeable. Perfect. You're going to have 12 marks for that. Clinical and technical skills, you're going to have 4 marks. What does it mean by the clinical and technical skills? In case of the knowledge, in case of the critical care, you will be shown maybe some x-rays, some radiological images like x-ray or CT scan, MRI, okay? Or maybe they will be given some of the labs like the blood reports or the ABGs, okay? So you need to interpret those things very efficiently, and that should be correlating with the problems or surgical relevance you need to have. That's the clinical or technical skills that will be given as a marks in case of the critical care. And also you need to show professionalism in case of this particular station. So what does it mean by the professionalism in case of these critical care stations, right? So it means like you will be put into different types of scenarios where you need to have a complete type of decision making. You need to solve a little bit of problems, okay? You can give a little bit of judgment, or you need to give a exact amount of management plan, and also they will be seeking whether you are safe for the patient or not, right? So whether you are thinking about the patient safety or not, all of those things will carry the marks of 4. Okay, so about the knowledge part, is it clear? Anatomy and the pathology, you're going to have 20 marks for each of those. That means you need to be very knowledgeable to get the 20 marks. Okay, and in case of the critical care, for the knowledge, 12. For the clinical and technical skills, you're going to have 4. And for the professionalism, you're going to have 4. Is it clear for this part, everyone?
Yes, sir.
Okay. Now, about the skills, as I have mentioned, it has been divided into 4 different categories, right? One is the communication, another one is the history taking, another one is the clinical examination, and another one is the procedural skills, right? Now, in case of the communication skills, I have mentioned you are going to have 2 different stations, right? One is communication with relatives or some person. So let's call it with person. Okay, communication with person. That is the first station. And see, before each of the communication station, there is what station? One preparatory station. See, but there is no marking for the preparatory station. That means you are going to prepare yourself with the help of this particular station so that you can perform with the information in this particular station. Is it clear?
Yes.
Okay, right. All right. About the communication with person station, very important to know the marking. Okay. See here, the most marks are in the communication itself. Okay. 12 marks are in the communication, 4 marks in the knowledge, and 4 marks for the professionalism. Now, the professionalism will change according to the stations that I'm going to describe for each of the skills part during our class and during our hybrid workshop or during our um, main hands-on as well. Okay, I'm going to describe all of those things, how you are going to show different types of professionalism in case of the communication, in case of the history taking, in case of the clinical examination, in case of the professionalism, that has a different thoughts that needs to be given. All right. Now, in case of the communication with the colleagues, we call it the phone call station. Okay, communication phone call station. We are going to given as a 4 marks for your knowledge. Again, for the communication, you'll be given as a 4 mark. For professionalism, you'll be given as a 4 mark as well. And 8 marks will be given for our clinical and technical skills because there will be some different things will be there. Some bloods or all that stuff will be there. You need to interpret those labs and you need to give the appropriate amount of information to your colleagues as well, right? So that the marking will be in that way. All right. Now, the rest of it is almost similar, like the history taking part, the clinical examination, and the procedural skills is almost a little bit of similar. Like for the knowledge part, you are going to get off about of 4 marks. About the clinical and technical skills, of course, different station will carry in a different way of the scoring, right? So that will be carrying about 8 marks. About the communication, 4 marks, and for the professionalism, this will include 4 marks. Okay, there is only one procedural skills like there, maybe they will be given a maquette. What does it mean by the maquette? There will be no real patient, right? So you are not being able to communicate in that particular station. That's why there is no communication mark or there is no professionalism mark, whereas there is a complete clinical and technical skill mark will be given on the basis how you are going to perform. So that is will be 12 marks. So this is a little bit of idea, or you can take a screenshot, or I can just simply upload these images as well if you need to clarify more. But this is just basically it. And we are going to talk about these things more during our day-to-day class. Okay. Now, this is basically our scoring system. Wow, how it will look after you pass the exam. Okay, so this is a result that I have taken from one of our the finest student. Okay, he passed recently, and the exam was in November 2024, and he passed with in case of the knowledge, he got like 139 out of 160, and in the skill he got 153 out of 180. Trust me, this is so like so high mark. I think he topped into this particular station and he was a topper from our IMGs. Okay. So this will be just I have given so that you guys can have a boosts, right? After seeing this result, right? So nothing fancy about here. All right. Now, after this, let's try to break it down or go a little bit of deep inside of our different types of stations, how it will look like or how it works in particular, all of those stations. Okay. Is it clear till now, everyone? To all of you? Then I can go to further. Any queries or anything you need to ask till now?
No, sir.
No, perfect. All right. How many stations were there in case of the knowledge, guys?
Atik bhai, I have one question.
Yes, sure. Go ahead.
In a preparation station, how much time do you get?
Exactly 11 minutes, 1 minute to read the stem, 9 minutes for your preparation, and 1 minute to move. Each of the station will carry the exact same time. Otherwise, the circuit will break, right?
Okay, thank you.
Okay.
Uh, Assalamualaikum Atik bhai, I have a question.
Yeah, sure. Go ahead.
Okay. In the knowledge part, are those questions are written in the cards, like we pull up the cards in like in professional exam?
I didn't describe how it will look alike in case of each of those stations. I'm going to describe all of those things. Don't worry.
Okay.
All right.
Okay.
But before that, just give me the answer. How many stations are there in case of the knowledge I have mentioned?
8 stations.
Eight
Perfect.
stations.
All right. How they are subdivided?
Anatomy 3,
Correct.
Anatomy 3, anatomy and
Correct.
critical care 3, and
Right.
pathology 2.
pathology.
Two. All right. So let's talk about the first thing, which is anatomy. Okay. Now, as I have mentioned, for only for you, I have I have I have made the AI images as like a lookalike possible for you, and I have put those images here. All right. So in case of the anatomy stations, there are three stations that you are going to face. Okay. So these stations assess your understanding of the human anatomy. Okay. You may be presented with some of the anatomical specimen or images or the radiological images, or like, or maybe there is a human or there, right? So you need to identify the structures, and then you are going to discuss with the clinical relevance. Okay. And it is very much essential that you not only identify the structures but also understand their significance in the surgical context. Like, given examples like the branches of the facial artery, you need to know where, like during the parotid gland surgery, right? So you need to know their specific nerve branches, right? So you need to know where are those locations anatomically, and you need to have the understanding of the this surgical context as well, right? So suppose this is your exam station. You have entered into the station, and there are some images of the anatomy that has been hanged over the wall, maybe, or there is a table, okay, and over the table there are some images that has been given just like this. Suppose this is the image that has been given, okay, and you have been asked, all right, can you please identify what is number 13, or can you identify what is number 10, what is number like 9, and can you tell me what is the boundary of the anatomical snub box, please? What is the surgical relevance of the anatomical snub box? What are the contents of the anatomical snub box? This can happen. This can be your station, okay? So there is no flashcards, or there is no cards will be given, just like we had in our professional exams, but there will be some images, or like radiological images, or even there could be a human, and they can ask, all right, can you just show me over that person how you're going to do the surface marking of brachial plexus? Okay, so that could be a station for anatomy. Is this clear now, Dr. Ashfi?
Yeah, absolutely.
Perfect. Okay. So about the anatomy, we are going to face lots of difficulties. Nowadays, they have changed all of the images that has came earlier. Okay. So now they are taking the images from their own cadaveric library or museums. They're taking the images from those cadavers, and they're going to mark the like identifying points, and they're going to ask the relative questions from those images. Okay, so how we are going to overcome? We need to learn the topics, and we need to learn those things vastly. That means you need to know the anatomy by your heart in order to identify in your exam. Okay, so how can we achieve that? How can we achieve that? So that's why I have started to like show some 3D models, and I love to teach over the 3D models. Okay, so that you guys can have the idea, the perspective of the entire area, other than having one image and you just simply mug up and you just memorize for your exam. And unfortunately, anatomy is so volatile. And during your exam day, if you don't understand the basics, if you don't have the proper orientation of those structures, you will forget. That's a normal thing, right? So that's why we will put a little bit of more efforts on the anatomy, and we need to have the repetitions and for the anatomy particularly. Okay, let's talk about the critical care. Critical care is a little bit critical. Okay, so this is basically a little bit of typical station setup. Okay, once you are going to enter into the station, you will see there is a table. Okay, and there is an examiner is sitting, and there is a blank chair. You are going to enter into the station with a very big smile, and then you are mentioned, okay, good morning, your candidate number is this, and you're going to sit, and then your station will start. Okay, so normally the examiner is going to have a sheet of paper in his hand, and he will ask the questions from those sheets. It's a completely structured exam, right? So suppose this is an sheet the examiner is having in his hand, and he will just simply go by these questions. Okay, and you need to give the answers according to those things, all right? And as I have mentioned, the stem could look like this, but a little bit of bigger perspective over the wall or over the door. Okay. Now, in case of the critical care, this is very, very crucial. Why I have mentioned this? Because this will not only check your knowledge, but also it will check whether you are sound with the clinical and technical skills and do you have the professionalism or not, right? So there are basically 4 subcategories of the critical care stations. Normally, you need to put the emphasis over the preoperative and postoperative care like fluid management, pain management, nutritional support, or surgical complications, right? Second one is the emergency and the critical care management. Like you need to know the management of the shock, like also the acute airway management, the management of the sepsis or septic shock, or some of the complications. The third one is you need to have a complete sound knowledge over the applied surgical physiology. Like you need to know about the acid-base balance, how to check the hemodynamic stability of a patient, or how you're going to monitor those. You need to have a sound knowledge of a proper interpretation over the ABG, ECG, chest X-rays, right? And finally, you need to have a sound knowledge over the clinical decision making and management of critically ill surgical patients. So that's where the ATLS protocol, the CRISPS protocol, the ALS protocols, those will come in handy so that you can have a proper management plans for your patients. Okay. So everything, whatever you are seeing here, everything will be mentioned during the classes, and I'm going to break it down for all of you. And I will go into the molecular level so that you guys can understand. So the basic thing is to create the basics strong, right? So that you can face your exams very easily. Okay, that's the critical care. Let's talk about the pathology. In case of the pathology, there are 2 stations, and also this is a little bit of similar exam station type. You are going to have one examiner sitting, there is a table, and you're going to have one blank chair. You're going to sit over there, and simply as it is a pure knowledge, so you will be given questions and you're going to give the answers according to your questions. Okay. How much time you're going to have, everyone?
11 minutes.
For the performance, how much time you're going to have? You have 1
9
minute.
minutes.
9
Exactly.
minutes.
Exactly. 9 minutes you're going to have. Okay. Now, in case of the patho, what are the things you need to know, right? So maybe you are going to give a little bit of pathological reports that you need to identify. Okay. Or they can given some images of the histological slides or the specimens that needs to be identified. You need to give a diagnostic reasoning, like, for this specific pathological patterns, is there any common surgical conditions are associated with that or not, right? So you need to distinguish between the benign and the malignant conditions as well. Also, you need to have clinical correlations among those things. You need to make a little bit of diagnosis, and you need to give a little bit of differential diagnosis as well, right? So all of those things will happen in case of the pathology. But trust me, why I have making these slides a little bit like, like you can see like the colors is not good, right? The colors is bad. And that's why I say like in case of patho, this is this is bad for us, okay? Why? Because in each exam, trust me, 10% of the questions will come from different perspective, or they can give a little bit of new questions just to maintain the standard of OCS exam. Okay. So in patho, you need to know about the basics of the patho. Also, you need to know some of the cancer things of the patho. Okay. So they can ask anything, any stations in every stations. Okay. So that's why I call patho is a little bit tough, because new questions will be there, at least 10% of those. And it is like, during the studying, um, few candidates will feel difficulties for like go for the basics, and they will feel bored during the patho studying, trust me. All right, so we have covered the knowledge segment, including the anatomy, critical care, and the pathology. Now tell me, do you have any queries regarding those things, and is it clear for all of you or not about the exam setup and the things that you're going to face into those particular stations?
Bhaiya, can you please tell me about the pathology once again?
Definitely. So in case of the patho, suppose giving you a perspective, you enter into the station, okay, you see it, and there was a stem like this, okay? There was a stem like this. And after you are going to enter, maybe they're going to ask, all right, did you read the stem? I said, yes, I read the stem. Okay, so according to the stem, what do you think the diagnosis could be? Okay, so I'll mention, all right, maybe this is a case of infective endocarditis or something like that. So they were going to start with, okay, can you define infective endocarditis? Okay, and they will start going for similar questions, okay, according to those things. Till now, is it clear,
Yes, I
Dr.
am.
Fan? Yes.
Yes, I am.
So
Thank you.
that could be one scenario, okay? Another scenario is you have entered into the station and then they have given one images. There are like multiple cysts over the kidneys. So that could be a polycystic kidney disease station, okay? And they're going to start asking few questions related to that, okay? Another one, you have entered into the station and they have, in the stem, they have mentioned, okay, there's a very old person and the person has gastrectomy done and blah blah blah. Also the patient was alcoholic smoker. Now the histopath report showed there is a signet cell ring has been present as well, right? So they will ask, all right, what is your diagnosis? You will mention, all right, this could be a case of gastric cancer or something like that. And then according to that, they will show you one pathology report and they will ask, all right, how can you describe the pathology report with the family members in few simple lines? And then the follow-up questions will go. Okay, so it could be anything like this kinds of things about the batho. Till now, a little bit more clear, Dr. Fahad?
Yes.
Perfect. Okay. Any other queries? Anyone? No. All right.
I have one
Mhm.
more thing.
Yes, yes.
Like for anatomy questions, like do they ask like whatever they think or whatever they like to ask?
No,
I mean,
no. They will ask only the structured questions that has been fixed by the RCS colleges as well. Okay, only.
okay, okay,
They cannot do the cross questions. They are not going to ask you any questions other than the structured questionnaire. Okay.
okay, okay.
Any other queries, please?
Assalamualaikum, bhaiya.
Alaikum assalam. Yes.
Ji, in case of pathology, we have to diagnosis. We have to diagnose the case
Yes,
and
you have
then
to.
start our question answering session, or
Depends upon the
directly
station, but
asked
mostly
from
yes.
the.
Depends.
At first, I have to diagnose.
Depends. Like, in most of the stations, yes, you need to diagnose the case and then they will start asking follow-up questions. Depends on the stations. Maybe they are going to start with the direct questions. All right, can you define infective endocarditis or something like that as well? Depends upon the station.
Assalamu alaikum.
Walaikum assalam.
Thank you.
Bhaiya, will they give another piece of question paper in the
No,
examiner's hand?
nothing. Nothing.
Yes.
The questions you are going to hear, only verbal questions you are going to hear. You cannot see any questions. Any other questions? Any other queries? No. All right. So we are done with the knowledge. Let's talk about the skill part. Okay. So as I have mentioned about the communication, in the communication, how many stations were there in the communication, guys?
9.
Station.
In the communication, Dr. Ashfi, 2 stations were
Yeah.
there, right? In the skill, there were 9 stations, but in particularly communication station, there are 2 stations, right?
2 stations.
And
Yeah.
before each of those communication stations, what I have mentioned, there is one
Preparatory station.
preparatory station. Perfect. Okay. So what does it mean by this communication preparatory station? Okay. The time is again 11 minutes, 1 minute to read the stem, and 9 minutes for your preparation and 1 minute to move. Okay. Suppose this is the station. Okay. You have entered into this room and there is a table. Okay. Over the table, you have been given some papers and pencils are been kept, and there is a case file, okay, for the patient's case file. In the case file, there are maybe 12 to 15 pages mentioning all the information of the patient. There could be some surgeries has been done, the OT notes has been written, the follow-ups has been written, the consultations has been written, what are the management options are there, that has been also mentioned, and what is the plan for the patient, that is also been mentioned into the case file. So according to those, we need to prepare ourselves. Okay, this is about the preparatory station. There will be no examiner. You will be alone into this particular station. Okay, now once you are done with your preparation, please take your paper. Okay, whatever you have write, please take this paper with you and move to the next stations. Don't ever take this case file with you. Okay, never ever. This is about the communication preparatory station. Is it clear? Everyone, is it clear?
Clear.
Yeah,
Yes.
yes, yes.
Yes.
Yes, perfect. All right. Now let's talk about the communication. The first station, as I have mentioned, communication with person. The person could be a caregiver. The person could be the patient himself or herself. The person could be the patient's family members as well. Okay. Now, what is the scenario of the communication with person? Normally, when you are going to enter into the station, you will see there are two examiners. Okay. Now, why there is a two examiners? One is a medical examiner and another one will be the layman examiner. What does it mean by the layman examiner? Because the patient is a layman person, right? The patient, like, she will not understand your medical jargons. That means you cannot communicate in this particular station with the patient or the persons in any medical words or sentences. You need to mention the layman terms, and that's where the layman examiner will come in handy. Okay, so is it clear about the station setup? Okay, there is a table, one patient
Okay.
with whom you are going to talk,
One
two
patient,
examiners,
two examiner. One is
and
medical related, and another is layman examiner. Who
one is
who
medical examiner and another one is the layman
and
examiner.
this is layman.
Right.
Layman
Medical
examiner
examiner.
observed our medical term.
No. The
Which
layman
we
examiner
are
is going to observe whether we are going to
observe
talk
our
normally, right? With
yes
the patient, because the layman examiner does not know any medical terms,
any medical terms, just
right?
like abdomen, just like
Tummy.
tummy for
Right.
abdomen.
Right. Exactly. Okay. So about the communication with person, this station is going to evaluate your communication skill, ranging from gathering and conveying the clinical information to delivering a complex or sensitive messages to those person. You need to be focused on clarity. You need to show empathy, and you need to have the ability to tailor your language to the patient's level of understanding. Okay, that's where some of the key skills where you will be assessed, like whether you have given the information which are logical, which are concise, and you are going to avoid the medical jargon. So you need to have a clarity and you need to have a complete structure. Okay. You must show empathy towards the patient, and it should be patient centered. What does it mean by that? Like, you need to have a complete focus over the patient. Okay. Always, suppose the patient is going to mention, all right, I think I'm going to die. All right. Or I think I'm having a cancer. You must show empathy. How you're going to show the empathy? Oh, I'm really sorry to hear that. You are currently in this situation. Okay. But you can be rest assured you are in a very safe hand where we are going to take care of you. All right. Next, you need to adapt, like, the communication skills that you need to have for this particular station for specific patient. Okay. And always remember, you need to have a feedback or clarification. What does it mean by taking a feedback or clarification? So see, after each of the slides, I'm asking you, right? Is it clear to all of you? Do you have any queries? Do you have any questions to ask to me, right? That is called feedback, correct? What is the technique I'm using? Like, after each of those slides, I'm asking again and again, All right, tell me how many stations are there in the skills, how many stations are there in case of the knowledge, how those are subdivided. This is called teach back techniques, right? So you are going to teach me whatever I have taught you, right? So you need to show those things and you need to achieve those key skills in case of the communication with person. All right. So I hope this is clear about the communication with person station a little bit. See, during our each of those segments, we are going to talk about a lots of things, a lots of tips, a lots of techniques. I'm going to mention how you're going to do those things efficiently. All right. But for now on, is it clear how this will happen? A little bit, yes.
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 Okay. Any
Dr.
queries?
Adit, I have a
Yes,
question.
please.
Can I ask, please?
Yes, definitely, yes.
After entering into the communication style, means for person communication, I have to look forward, like in the picture showing towards
No,
the
no, no,
exam.
no, 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 no. See, that is the like, that is the um tough thing. I was trying so hard to like, to change the direction of the student towards the patient, but I couldn't. I'm really sorry about that. As I have mentioned, I have generated some AI images, which is completely tailored for this orientation, but I tried so hard, but I couldn't do that. But you have just noticed that this is the not exact position you should be, right? So you are going to be looking towards the patient and you are not going to talk with the examiner. You are going to talk with only the patient in case of the communication person. Very well noticed, Dr. Tamanna. Hats off. I guess
I
you
have
got your
another
answer. Yeah.
question. Yeah, thank you. I have another question regarding the knowledge part. In knowledge, the STEM will be written in the door when I'm standing there for 1 minute,
Yes.
or
Yes,
I
it will
will
be.
have an knowledge about means what is my
What is the
pathologist
station you're going to
going
start?
to.
Yes, yes,
Okay.
yes, you will.
And in that
But
case, I have
so
to
the
enter.
the the station, the STEM, the name of
Yes.
the station will not be written, right? You need to assess, you need to know how you are going to make the diagnosis. And you need to assume, okay, this might be my station. Okay, so exactly it will not be written, okay, this is a pathology station, this is a
No.
clinical
I
care
will
station.
be able to see the question, right?
Not the
That's the
question, not the
STEM.
question, but the STEM. Yeah.
Okay. And when I enter into the room, the examiner will ask me the questions, or I will be able to see the questions also.
No, you are not being able to see the questions. The examiner is going to ask, and the questions will come to you as verbally only.
Okay. So should I mention my candidate number or something else after
Yes.
entering each station?
After each entering each station, you need to greet the examiner or the persons, and then you need to mention your candidate number, and then you're going to start your examination.
Except in communication with person.
No, the same thing. The examiner will also ask, what is your candidate number, and then your station will start.
So I will just enter into the communication with person station, and I will look forward towards the patient, and will start my communication.
Correct.
Okay. Thank you so much.
No
With
problem.
greetings. With greetings and your introductory words.
Mm,
Am
What
I
kind
right?
of introductory words?
As I'm Dr. X, the surgical examinee.
No, that is
I
not required. That is not required in case of each of the station. That is only required in case of the clinical examination,
communication skill.
history taking, and procedural skills. In fact, in case of the communication station, your station can start in a completely bizarre manner. Trust me. Okay, that's a different scenarios that I'm
Oh,
going to talk, that I'm going to mention during the classes of different types of stations. Okay. Let's not talk
okay.
or go in details because it will take like maybe a whole night, right? If I'm going to go for each of those things. But yes,
Okay.
in general, is it clear about the communication station to all of you? The person
Yes, clear.
mainly. Perfect. Okay. The next thing is the communication phone call station. And before the communication phone call station, what you are going to face? Again, the communication preparatory station as well. And again, the same thing, the same setup will be there. And you are going to prepare yourself for 9 minutes. Okay. And then you are going to take your paper and you are going to move to the next station, keeping the patient's case file as it is over the table on the communication preparatory station. Okay. Now, how does it look like as a communication phone call station, right? So simply you are going to enter into the station and you will see two types of things that can happen. And I have infused the two situations together. Okay. So you are going to see the same case file that is written over the table. Okay. And after entering, you will see there is a screen and basically there is an audio call is ongoing. There is no person in the room except you. Okay. And this is basically an audio call. Okay. This is one type of situation you can have. Another one is there is no screens, whereas there is only a telephone and it is written press 0 or press this button to start. Okay. So you are going to hold the phone and you're going to start talking. This is about the communication phone call station. This is your scenarios you are going to have a little bit similar. Okay. All right. So what are the key components in case of the communication phone call? Here, with whom we are going to talking to? We are going to talk with our colleagues, right? Maybe that's a registrar, or maybe that's a consultant, or maybe that's a professor, right? So here, are we going to use the layman terms or the medical jargons, guys?
Medical jargon.
Medical terms.
Exactly. So here we are going to talk in our medical words or medical jargons, right? So the key components is you need to structure the information transfer very, very efficiently. Okay. So you need to give a clear information about the patient and you need to discuss about the management plan, okay, to your colleagues. All right. You need to have the ability to listen very, very actively, and you need to have a engagement during the communication with the person as well. And you need to show respect and empathy during the interactions during your full conversation. You need to have a clarity and conciseness because you need to have a effective communication, and also you need to have a ability to handling the challenging interactions. Okay, maybe your consultant is mentioning something which he or she is disagreeing, and but you need to mention something else so that they are going to agree with you with the logical steps. Okay, so these are some of the key components, and we are going to describe lots of things, how you're going to format, what are the things you need to write over the papers so that you can have a proper effective communication, how to address those, okay, during with your colleagues as well, okay, how much time you need and how can you have a high score in the case of the communication phone call station as well. Okay, particularly in the skill part, the communication with person and the communication phone call stations are the most easiest one. Okay, is it clear about the communication phone call station as well a little bit?
Clear.
Whenever you ask about the screen, will there I have to press there something, or I have to take a phone call or something?
Nothing else. It will be complete. It will be ready basically when you are going to enter. It will be ready, and over from the screen, as I mentioned, this is an audio call, so they will ask you what is your candidate number, and then your exam will start.
Okay.
Okay. All right.
Yeah, from the other side, someone talk with us
Yes, live.
live, or according to my lead or according to my questions, like this.
Yes. Simply, you're going to
As
start. You're going to start.
as
Okay, your introduction. Okay, and why
okay,
you have called. Okay, and they will ask you
okay,
to summarize your case. And after the
okay,
summarization, they will ask few related questions, and you need to give the
oh,
answers particularly.
okay, okay. As just like we call our consultant and they ask about the
Exactly.
cases.
Exactly. Yes.
Thank you.
Okay. Let's talk about the most important one, the clinical examination. Okay, so in case of the clinical examination, we are going to have three stations particularly, right? In the scenario, you're going to have one patient. That means you need to communicate with the person, right? And you are not being able to use the medical terms while you're communicating with the person. That's very important. You need to show empathy. You need to be very, very cautious about the patient's pain before you are going to touch the patient, and also while you are moving the patient or touching like in superficial palpation or deep palpation in case of the abdominal examination, or in case of the orthopedic examination, you are moving the joints or the any parts of the body, you need to be very cautious about those things as well. Okay. Now, here in these particular stations, these stations is going to evaluate your proficiencies in clinical examinations. You might be asked to examine the abdominal examination or respiratory examination, CRISPs, or orthopedic examination, as I had mentioned. So you need to have a systematic examination technique so that you are going to finish within the given time. Okay, so about the time, as I have mentioned, right, it is a little bit different in case of the clinical examination. Okay, how it works. 1 minute you will be given to read the stem, that is same. Now you have 9 minutes after you have entered into the station. There is one examiner who is going to check whether you are going to do the examinations very correctly or not. There is a patient over whom you are going to do your clinical examination. Okay, and you need to do this clinical examination. That means you are going to perform over 9 minutes. Now, in case of the clinical examination and the history taking, these 9 minutes will be subdivided into two categories. One is the first 6 minutes will be given for your clinical examination only. Okay, that means after the 6 minutes, you are not able to touch the patient, or you are not allowed to do the clinical examination over the patient. Am I clear? That means suppose you are being asked to do the respiratory examination of the patient, or cranial nerves examination of the patient, or respiratory examination, or cardiovascular examination. So everything you need to do within these 6 minutes. Okay. Now, what you are going to do with the 3 minutes then? With the 3 minutes, you are going to present whatever you have done with the clinical examination. You are going to make a diagnosis, and also you are going to give some differential diagnosis. And then after that, the examiner is going to ask you few related questions, particularly what are the investigations you want to do, and what will be the management, and some questions, some extra questions. Okay. That will be answered within the 3 minutes. Am I crystal clear? 1 minute to read the stem, 9 minutes for your performance that has been subdivided into 6 minutes for your clinical examination proper, and 3 minutes for presentation, making the diagnosis, and giving the answers to the questions that will be asked by the examiner. And then after that, 1 minute to move. Is it clear
Yes, sir.
about the time? Okay, perfect. So as I mentioned, you need to know the systematic examination techniques. You need to learn about the identification of the clinical signs. Suppose the patient is going to mention, all right, in the stem, it is mentioned the patient is having a pain in the right hypochondriac region, and you have been asked to do the clinical examination over the patient, but you cannot take any kind of history from the patient, right? So what is the first special clinical signs that is hitting inside of your mind? You need to check. Anyone?
Murphy's sign.
Exactly. Excellent, Dr. Ashfi. Perfect. So we are going to do what? We are going to do the abdominal examination, right? And within the abdominal examination, we are going to check the morpheus as well, right? And then we need to present in those categories. And always remember, as I mentioned earlier, the patient interaction is very crucial in case of our clinical examination. Why? Because we are going to examine, and also we are going to communicate with the person that I'm going to touch over your tummy. I'm going to press a little bit further over your tummy. Is there any kind of pain? Please let me know. Okay. Just feel free to mention if you are going to have any pain. I will be love to give you some painkillers, or just you can stop me whenever you need. Okay. So you need to communicate with the person very well in order to have an efficient amount of scores in this particular station. So how many stations you are going to face in case of the clinical examination, guys?
3 stations.
Station.
Correct. Okay. So let's talk about the history taking station. Okay. Now, again, in case of the history taking stations, we are going to have two different stations, right? And the timing is the same as the clinical examination. Okay. Now, 1 minute you are going to be given to read the stem, 9 minutes for your performance. This is subdivided into two categories. 6 minutes for taking the history, And 3 minutes again to present your case, making your diagnosis and giving the question and answer session. Okay. And finally, 1 minute to move. About the time format, is it clear in case of the history taking as well, everyone? Yes?
Yes, sir.
Perfect. Okay. Now, about the scenarios within the station, again, as you are going to communicate with the patient, right? And mostly this is a history taking. That means you are going to talk a lot with the patient. That's where you are going to have one layman examiner. There will be one medical examiner as well. The patient will be here, and you are going to given one pen and paper over which you can write. Okay, the important things like the patient's name, the age, the main complaints the patient has been given, the positive findings that the patient is going to give, all of those things you can write over that. Okay. Now, the objective of the history taking is you are going to be assessed for your competence in collecting the essential information from the patient. You are going to formulate a clear picture of the clinical situation and you are going to establish a report with the patient. The context is typically you will be presented with a different standardized patient or a simulated scenario that involves a surgical complaint or condition. And you need to be required with a systematically obtain a detailed history. How we can do that, right? So you need to have a structured interaction, right? That means you need to have a framework. And that's why I always mention in case of the history taking, you need to know what is the 10 steps approach. Okay. You need to have a comprehensive data gathering. Okay, that means you are going to take the presenting complaint, the past complaint, the chief complaint, the surgical history, the family history, the social history, all of those things that will be given into the 10 steps approach that I'm going to mention how you're going to take the history taking within the 6 minutes, maybe within 5 minutes even. Okay, and that can be done. You need to engage the patient. You need to listen to the patient very actively, and you need to show the empathy again here as well. Okay. And the time management is very, very crucial because you need to ask lots of questions, trust me, within the time frame. So that's why the time frame or the time management is very, very crucial in this particular history taking stations as well. Okay. So about the history taking station, any questions or any queries do you have?
No.
Perfect. All right. So what we have?
Yeah,
What we left?
can you please tell again about time management in history taking, if possible, please?
Yes, time management means like, you need within the 6 minutes, you need to ask the questions, right? For your history, like to complete your history taking, like you need to, as I had mentioned, you need to gather lots of data, right? You need to take the chief complaint, you need to know about the presenting complaint, you need to know about the past medical history, the surgical history, the allergic history, the family history, the social history. Also, there is one thing very important that is called IS, the IDS concerns and the expectations from the patient, right? And also you need to do the systemic evaluation. So all of those things that should be done within the 6 minutes. So about the time frame of the history taking, again, as I've mentioned, 1 minute you will be given to read the stem. Then you will be given 9 minutes for your performance. This 9 minutes has been subdivided into 6 minutes and 3 minutes. The 6 minutes has been given to ask the questions from the patient. After these 6 minutes, you are not allowed to talk with the person anymore. Okay? And after you're finished with the 6 minutes, within the 3 minutes, you need to present your case, you need to make your diagnosis, you need to give your differential diagnosis as well. And then the examiner is going to ask you few related questions according to your station, and you need to give the answers. I hope it's clear.
Okay, thank you.
Perfect. Now tell
Excuse
me.
me.
Yes, yes.
Yes. What type of questions we have to face during the question session of history taking? Will it be a structured questionnaire?
Yes,
Oh.
all the questions are structured. All the questions are structured questionnaire you are going to be asked. Okay. So there is no other questions.
Which one will be faster? I will go and present the case in front of the examiner, or the examiner will ask me about my presentation or my diagnosis.
Correct. Yes. So the first thing is after you are done with the questions, okay, so you are going to present your case looking towards the examiner. Okay, I have taken the history from anyone, like maybe Ashfi, who is 30 years old and he has been presented with this, and the patient is having some positive findings. And based on that, my diagnosis is this, and my differential diagnosis is those. Okay. After this, the examiner is going to ask, all right, can you please tell me what are the investigations you need to do to justify your diagnosis? So you're going to mention, okay, I want to do some investigations, whatever you want to mention. And then they will ask, all right, can you tell me how you're going to manage your case then?
So it
Right.
will
So
not be a random sequel, I think.
no, of course not. This is not a random. This is completely structured. Okay. So you need to make your diagnosis correctly. And then according to that, the examiner is going to ask you the exact questionnaire questions.
Okay, got it. Thank you.
Perfect. Now tell me, I have talked about the knowledge. I have talked about the skills. I have talked about the communication, history taking, clinical examination, about the two stations of the communication. So which is left? What is left?
The procedure. Yes.
Excellent. The procedural skills. Let's talk about that. Okay. So I have tried to make an image in case in our Bangladesh, if there is an exam for MRCS, maybe this will look like that or something like that. Maybe. Okay. So in case of the procedural skills, we are going to have again two stations, right? And the procedural skills station is very interesting. Okay. About the time format, you are going to have exactly 9 minutes for your performance, right? But here, you need to have two things, okay? You need to have two things together, like that is called multitasking, as I said. You need to do your procedure as well, and you need to communicate with the patient and also with the examiner as well. That means you cannot stop during your procedural skills station, okay? While you are doing the procedure itself, you will be asked few questions from the patient, and the examiner is going to ask few questions to you as well, and you need to give the answer simultaneously while you are doing the procedure itself. In a station, you will be seeing there is one examiner, there is one patient, or there could be there will be one method as well, like where you don't need to communicate with the patient, and there is one assistant who will be there who is going to assist you. Okay, you need to take your instruments. All the instruments will be given. Okay, whatever you need. And you need to start your procedure, and then you will be given 9 minutes to complete your procedure, irrespective of different kinds of stations. Okay. Now, the key components are you need to have a technical proficiencies, right? So you need to know or you learn like very precisely and with the confidence to perform a procedure. But trust me, the procedures are not that much hard. Like maybe this is a suturing of a clean wound, or you need to do a male catheterization, or you need to do abscess drainage, or maybe you are going to excise a nevus, or maybe you are going to do a knot tie, right? So the stations are very easy, but you need to be know how to handle the instruments. What are the proper use of the like proper techniques that that needs to be done for the suturing, knot tying, right? So you need to know the patient safety as well. What are the aseptic techniques are there? What is the sterility techniques are there? You need to go in a stepwise approach towards the patient. Like you cannot just simply go and start your procedure, right? So there is also a 10 steps approach that I have made for the procedural skills. You need to follow those things. You need to have the adaptability as well. And for effective communication, you need to know how to do communication very well with the person and with the examiner while you are performing the procedure itself. Okay, so those are a little bit of crucial, but it is done very well. Trust me, you can be very, very lucky to have this, like because in our subcontinent we are allowed to do a lots of procedures, and that's why you will be very, very professional in those cases. Just you need to know what are the contexts, what are the specific things you need to know in order to gain the highest score for the procedural skills. Okay, so you are going to face two stations mainly. in case of the procedural skills station. Okay, very interesting, and I trust over you, all of you, that you are going to have a very excellent procedural skills, inshallah. Okay, so any queries or any questions for the procedural skills?
Assalamu alaikum. In during procedure skill, we follow the ideal procedure according we learn from your course.
Yes, I'll be mentioning exactly stepwise what are the steps, how you're going to perform. Okay, stepwise clearly. If you are going to follow those steps, then everything will be easier for you. But not the
This is
conventional method, not the conventional method that we have learned in our countries.
the
Definitely not.
patient is dummy or alive patient, individual
Okay,
person.
so the thing is, the patient, wherever you are going to have a patient, the patient will be real patient. But suppose there is a problem here, okay, and you need to operate this area. So the patient will be lying. The patient is the real patient, but there will be a maggot, okay, will be tied over this area. So over the maggot, you are going to perform. You are not going to perform over the real patient skin or tissues, whereas you are going to perform over the patient, real patient, but the patient will be tied up with the maggot over which you are going to perform, or you are going to do your procedure itself.
For the patient, there is a maggot means dummy.
Yes, yes.
Oh, okay. Thank you, man.
All right. So is it clear till now, everyone?
I have a question.
Yes, go ahead.
Will there be any countdown timer to assess the time, or it is just a confidential mapping of time by the examiners?
No, there will be no timer. Only you are going to hear after each segment, like the 9 minutes is over, or the 6 minutes is over, or go to your next stations. Okay, but there is no countdown or there is no timer that will be showing your time. So you need to practice very precisely for each of those stations.
Okay, thank you.
During the procedure skills and the physical examination stations, is it mandatory to stand on the right side of the patient to do the procedures, or
Yes,
we can
yes.
stand anywhere?
No. You need to stand on the right side of the patient. Any other queries for the procedural skills?
Regarding the procedure skill,
Mhm.
so we should be methodical. It's must.
Systematic,
But
yes. Mhm.
in our country, will they allow that method? But which are their method?
Definitely, definitely there is a different methods that you need to follow. Definitely, for each of the station, there are different approaches that you need to do. Simply, just for an example, like before the procedure in our countries, we don't check WHO surgical safety checklist, right? But in order to do your procedure in case of the MRCS exam, you need to ask for the WHO surgical safety checklist before you're going to start your procedure. Also, you need to check the bracelet of the patient. You need to ask few questions like, are you allergic or are you taking any medications or not, right? Also, you need to check all the expiry dates, like you need to dispose. Oh, there are lots of 10 steps that you need to follow in order to have the exact full marks. Okay, that you are going to learn during the class, definitely.
Okay, we learn, I think, from you.
Yes.
So, is there any chance of subjective judgment by the examiner?
Like?
Like their subjective judgment. That's so you have told that all will be in structured form, in
Correct.
methodical form.
Correct.
Okay, so there is no chance of them to do the bias to be
The cross
biased.
questions. No.
Okay, thank you.
Right. All right. So I think you have learned about a little bit of structure of each of those stations. Yeah.
Yes,
Each
sir.
segments, about the introduction, also about the scoring system. How does it look alike a little bit? how does the station works, how many stations are there, what are the things you need to know, what are the things you need to learn. I hope this is a little bit clear. Yes, to all of you?
Yes, sir.
Perfect.
Yes,
Okay.
sir.
Now, there is one question that has been asked to me like many times, like, what is the preparation time we need to have before my exam, right? So I always mention, like, see, you need to have at least 4 to 6 months for a complete preparation on an average. See, different person learn the things in a different pace, right? Maybe Dr. Ashfi is learning a thing within 5 minutes, and I'm learning those things in 1 hour. So it depends, right? About the months, about the time. Maybe you are a working person, so you can give on an average of 4 to 5 hours a day, not more than that. So if you can, and on an average student, I can mention, all right, it will take about 4 to 6 months on an average to prepare yourself. Okay, this is a sweet spot. Okay, if you want to, like, take more time, that's completely all right. If you are able to complete those things within 2 months, then you are a brilliant student. Okay, and there are like lots of students have done those things as well within 2 months, 2.5 months, 1.5 months even. Like the shortest one was, after taking the course, he took it about 17 days and he passed. Okay, but I'm not mentioning the like exceptional things. Okay, so on an average, on a average student, on a given average time, you need to have at least 4 to 6 months to prepare yourselves fully, completely, with a confidence you can break it. Okay, this is about the preparation time. All right. About the expenses of the exam, it depends actually. It depends on the where you are going to give your exam, right? Maybe you're going to give your exam in UK. Maybe you're going to give your exam in India. Maybe you're going to give your exam in Malaysia or in Egypt or in Middle East, right? So it depends upon where you're going to give, right? All right. Next thing is about the registration. So now the registration fees are going high, right? So it ranges from 1,100 to 1,300 pounds, right? Maybe you're going to take the course that will cost you about 250 to, like, some courses too much expensive, right? So it can range as, maybe you are going to need a hands-on, maybe not, right? So it depends upon the different things what you are going to take. Maybe you are living in India, okay, and you're going to give your exam in India. You are not going to take any course, okay. Just simply go for your registration, and this will cost a little bit less. That's it for the expenses. Next question, like most of the questions I get like this, like, what are the study materials I'm going to use, or what are the study materials I need to go and I need to learn from, right? So see, I'm not mentioning just because I'm from IMG. I'm just mentioning in a as a like, in general. So what we use our IMG books, right? But trust me, almost all the study materials, and trust me, I'm a very brutally honest person. So I'm mentioning all the study materials are almost similar. Okay. Almost 70% of those things will be the same thing. Why? Because see, the study materials has been created from the questions. So in case of the part A, there are like there are recalls, right? There are different areas from where you can learn, like the EMRCS, the past test, the FAUSIA, the recalls, right? But in case of the part B, we don't have those recalls. Why? Because from the recall, these books have been made. So there is no basically recalls. You can have a recalls of like the stations that has been came at a particular given center in a particular date, but there is no specific questions of recalls you're going to have anywhere, right? So about the study materials, why our study materials is a little bit different? Because see, what is the best study material you can have if you are going to make your own notes, right, from different study materials for after researching, or it is up to date, or you are going to add anything whatever you have listened or you have heard from any other candidates. So we are going to do those things for yourself, right? And we are going to compile those things into our IMG notes. And that's why I said, all right, this is a unique one. because almost 90% of the questions will be the similar, and 10% we cannot do anything with those things. Okay, and trust me, no one can give the 100% because this is out of the standard of the RCS. They are going to change the 10% of the questions so that no one can have the highest mark, just to keep the standard of the RCS exams. Okay. So about the study materials, I can mention, all right, whatever you are going to use, try to use only one study material that is unique, and you need to go through the same thing. All right. How you're going to utilize the study material, that's up to you. But you need to have the most updated one, and which has the most important questions, and all the questions will be covered. Okay. That is about the study material that you can use. Okay. Now, about many of the candidates ask me, all right, can you talk about your course, like what you are going to provide, what you are going to give in case of the IMG Academy course, and why it is different from the other courses, right? So about our IMG course, like how I have made this, right? So during my own preparation, I searched for different courses, and I saw, like, see, not most of them are effective, correct? Why? Because they are not going to make you understand the basics, right? Rather than they will just go for the line by line, or just giving you some of the recorded things, and you're going to go through those things, all right? So what I have done is I have I have constructed the course in according to my research, which will work on me. And trust me, I'm an average student. So our course will work on particularly on the average student. Maybe you are bad or maybe very good, right? So it has been modulated according to those. I will go deep into the basics rather than I will force you to mug up or memorize for your exam. No, it's a complete no. You need to understand the basics. You need to understand the concepts first in order to give your exam. So finally, like, Alhamdulillah, till now we have more than like 200 successful candidates till now. And it's a fair amount of success rate and the pass rate for all the preparation candidates, I can say. What else I'm providing, right? So see, this is basically an online sessions that I'm going to give, and I'm going to cover all the stations, all the questions, including the knowledge part, including the skills part, right? But now, the second thing is what we do some hybrid workshop and the hands-on as well. What does it mean by the hybrid workshop? Okay. Now, in case of the hybrid workshop, I'm going to show what are the exact steps that you need to have in case of your exam through an online video. I have been recorded those, and I'll be providing all of those things into your course as a free things, okay, as a hybrid workshop. So you don't need to worry about what are the clinical examination steps that I need to do, how I'm going to do that, right? You don't need to worry about the procedural skill steps in each of the stations, how I'm going to do those things, right? Because I have already recorded those and I'm going to provide those things. All right. Now, after each of the classes, the online classes, and also the hybrid workshop, the recorded videos of the steps that I have done, right? And I will be providing you all of those things into your course via the drive. If those are not sufficient enough and you need to do a hands-on, there is a options for hands-on. So till now we have completed 4 times of hands-on till now. And I must say there was a much, alhamdulillah, successful hands-on that we have provided. And I was the first one, I think, in Bangladesh that I have given the hands-on, and as a Bangladeshi, of course. And if you want, I'm not going to suggest that you have to do the hands-on, because I'm not into a best business thing. That's why I have given all the videos as for free to all of my course candidates. And if you want, or if you want to practice more in an exam situation, so you can come into our 4 days of workshops or 4 days of hands-on, and you can learn all the skills that you need, like the clinical examination, the personal skills, the communication, and the history taking within those 4 days, with the help of all the exact methods that you will be given in case of your in the RCS exams that has been imported, and you will be given as well, and you can practice on those things. If you want that, then you can have a hands-on. Otherwise, many of the candidates who are not from Bangladesh, from other different areas, they simply go through the live classes, the hybrid workshops, and they are well good to go, and they have passed with a very good, very high marks. The score I have given or I have showed to you, that is from one Indian candidate, and he never ever joined my hands-on as well. So everything he had, whatever you are going to have in case of the course. Okay. Next thing is what else we're going to provide is called the quick revision mock sessions. Okay, what does it mean by the quick revision mock session? Suppose you are going to join tonight, maybe. Okay, so I'm just mentioning maybe you're going to join tonight, but your exam is in May. But I am going to continue this course till June. So what you are going to do if your exam is in May, right? So what I'm going to provide is all the class recordings, all the mock recordings of the just previous sessions or the just previous cycle, right? I'll be giving you all the class recordings beforehand so that you can prepare yourself, okay, early. And just suppose your exam is in May 15th, okay? So just before your exam, 45 days prior to your exam, you will be added into a specific group, which is called Quick Revision Course Group, where all the stations will be taken as a mock for a quick revision, as in a mock type exams, and you can revise the whole stations, the whole syllabus within that 45 days. So this will help immensely for those persons, right? So in the general group, I'll be taking the live sessions and the live mocks, and also in the quick revision mock sessions, you can give the mocks if your exam is near before the, we are going to finish our course. So you can take both of those things, and also you can take one of those things as well. So the quick revision mock sessions are completely free for my course candidates as well. Okay, so these are the different things that I'll be providing, which you cannot have from any other courses or anyone else, because this is just for you. These things has been made for you so that you guys can be helped by me. Okay. All right. So at this part, this is an open floor to all of you. If you had any queries, if you ask anything, if you want to suggest anything, if you like whatever you want to mention, just this is your question answer session, guys. Tell me, was it effective for the orientation for your new exam? Did you understand or not? Just feel free to mention anything. This is yours. The floor is open. No queries, everyone?
Yeah, if possible, you can provide this recorded video.
Yes, definitely. I'm recording. I will be uploading this into the groups, also into the YouTube, and also into our course drive. Whenever you want to see, you can see this. No problem.
And also that this PDF can it post
Yes,
if
definitely. No
possible.
problem. Of course, yes. As I had mentioned, I will post this into our course drive as well. No problem.
Okay, thank you. Thanks a lot.
No problem.
Maya, one more thing, when they introduce a new topic or introduce a topic with new questions or whole bunch of new topics, like when they introduce something new.
Not normally completely new topics. Maybe that will be given as a pilot station. What does it mean by the pilot station? The pilot station is one station that has been given to evaluate the students whether they can cope with those stations or not. So there will be no marking. Okay. So that can be given if they are organizing a whole new topic, a whole new station. Otherwise, the little bit of changing of the questions will be given into a given stations. Okay. So the questions can be a little bit different. That is 10% of the changes that can be given. Otherwise, the whole topic will not be changed. Any other queries? Anyone? No?
From tomorrow, our course start according to our routine.
Correct. Yes.
Thank you.
This batch is only for August
It's
or
not like that. See,
April, May.
our course is like,
But I,
this is a continuous process, right? So
okay.
once you have joined the course, until you are going to pass your exam, you can continue taking the course, right? Maybe your exam
Oh,
is in
thank you very
January.
much.
Maybe your
Thank
exam
you
is
very
in
much.
January, right? So you can start preparing yourself from now and you can repeat the cycle as much as you like, right? All the class recordings will be
Thank you.
given, all the classes, live classes, you can,
Now I
you
will
can
set
join.
the.
Mhm.
I set my schedule on the August in coaching.
Perfect. So if you are going to join the course, then your this course will end in June, right? So through the June, all the syllabus will be end, and from June, again the new cycle will start from the very beginning. As like we are starting from anatomy from tomorrow, right? And we are going to finish it off by the communication. So once the full cycle is completed, then there'll be a gap for few days, and then the new cycle will start once again.
Okay. Okay. Thank you very much. Thank you very. Oh, another question.
Mhm.
There are 4 books in IMG, no?
There are 4 books. Yes, yes. One is
Okay.
for the
Thank you very
anatomy,
much.
another one is pathology, third
Anatomy,
one is
another
for
is
the critical
pathology,
care,
another is ACCS, critical care,
right.
and procedure skills.
One is skill, and within the skill part, all the
Skill.
segments are there.
All the station, 9 station is there.
Correct. Yes.
I have a query.
Yes.
Do the college matter actually under which I am
Mm,
giving myself
trust
part B?
me, if you know your stuffs, okay? If you know your stuffs, then the college does not matter actually. Okay. But they said like there is a little bit of variation of the markings. Maybe 10% variation will be there. Right now, Edinburgh is having the highest passing mark, then the Glasgow, then the England, and then the Ireland. So you can choose according to that, but it actually doesn't matter if you know your stuffs and if you are really good. Okay. If there is a
Many
certain
many tell me that England under England it's tough to
the
pass.
passing
Like
rate, the passing rate is low. Yes. Currently, it is showing like that.
so,
But
Yeah,
is
I
there
have,
any
but
necessity of taking
I have,
different
I
preparation? Is
have
the preparation is the same or little bit different or like that?
No, you are going to take the same preparation. I have taken my exam from MRCS England,
Okay, nice to hear that.
and I got the highest mark as well. So
Oh,
don't rest assured
congratulations.
at those. So don't
As I
worry
have
about
booked
those
for
things.
England, many have told
Mhm.
me that why have you booked for England? It's tough to pass.
Brother,
Um,
you are in a
so
correct course. Don't worry about those things. Okay, you will be tailored for this exam. Don't worry.
hope so. I am so enthusiastic about you. Okay,
Yeah,
thank
don't
you.
worry about those things.
if you give me
Mm.
permission, can I ask one question?
Of course, yes, yes. Go ahead.
Where if I follow only IMG materials
Mhm.
blindly,
Mhm. Do
I
you
think
need to follow anything else?
yes, like this.
You don't need to follow a single word from anything else. That is my word.
Okay. In case of I just follow your courses and your materials, and
Exactly.
revision is more and more, and it will enough
Yes,
for me.
exactly.
Okay, thank you, thank you.
Any other queries, please? Come on, guys. This is your chance to talk. This is your chance to communicate, right? This is your chance to clarify yourself for each of those questions that you are having in your head. So go ahead.
First of all, we should prepare ourselves as a candidate for the perfect position, perfect
Hmm.
sense,
Hmm.
perfect knowledge, perfect skill. Then we should go for the setup examination and we will pass through IMG. Thank you very much.
All right. Okay. So yes, so I hope all of you have the great time for these sessions and all of you had the understanding of whatever are the objectives that I have
I
given to
have a
you.
question. I have a question. I have a question.
Sorry, interrupt. Yes, go ahead.
How much time it takes to get on the training post after passing MRCS Part B?
You don't need to have any training.
For the further training, like in the like working in NHS as a surgeon or a rookie surgeon.
You don't need any training to work in NHS. Just after passing your exam, you get your GMC and you apply, and if you have been selected, you can go and work. No problem.
Okay, thank you.
Yeah.
How about the English skill, speaking or listening skill? How much it matter in the examination?
All right, so that's where it comes to the scoring system, right? You see, in case of the skills and also in case of one segment of the knowledge, the communication part, we're having how marks? 4 marks, right? That means you need to communicate very, very well. You need to learn the English, how to talk, how to listen actively, right? And you need to know the effective way of the communication very well in order to pass this exam. Trust me, that is our only barrier we're having currently right now as for Bangladeshi students, right? So you need to be very, very effective and very, very efficient on your communication.
Talking about the skill of English, talking, pronounce, I'm afraid of my pronunciation actually,
Pronunciation doesn't
as
matter.
it is very horrible. So, how
No.
about the pronunciation?
Pronunciation doesn't matter actually. It doesn't matter at all.
Oh, it's too relieving to hear that. Thank you.
Mhm.
What is the
I am
full
very
meaning of
weak in
IMG?
English.
One by one, please.
Carry on, please.
Okay, I just asked a funny question. What is the full meaning of IMG?
International medical graduates.
Oh, thank you. I am searching for it.
Right. Yes, Dr. Chaudhary.
I am very weak in English.
Then you need to
Though I
start
have passed
practicing.
the MS in vascular surgery, and I am working as a vascular surgeon in NICVD. Though I have very afraid.
Yes, that's what I said. Like that is the most problematic things we are having, right? We cannot talk, we cannot communicate very well. So how you are going to work on that? Do you have any idea, Dr. Chaudhary?
My question is that how I can overcome this
Very good
obstacle.
question. Excellent question. So my suggestion is please never ever make a partner from Bangladesh. Okay? You need to make a partner from different country. All right? So you'll be forced to talk in English. Okay? That's how you're going to prepare yourself. That's how you're going to practice, right? Otherwise, if you're going to, but how I'm going to, how I'm going to have a partner,
partner.
right? Exactly. That's where the IMG comes, right? You simply question into the IMG groups that I want to have a partner. So you will see there are lots of person is going to knock you. So choose from those.
Okay. Mr. Atik, Dr. Atik, I will message you in your own wall because there are lots of friends, and juniors are here who wants to partner with me. For that reason, I don't write on the IMG Telegram group.
Simply, okay, fine. So you can text me, all right? No problem.
Okay, dear doctor.
All right.
Okay, thank you. Can I leave?
No problem. Yeah, definitely you can. No problem.
Okay, well, today's discussion is over. Now, and any other?
Yes, I'm not going to mention anything. If there is any other queries, then I'll be loving to give the answers.
Atik
But
bhai, one more
thank
thing.
you.
The session is over. Yeah.
Hello, Atik bhai, one more thing. Like
Yes.
regarding our anatomy stations, like how much is similar to the MRCS part for the preparation? Like
Almost similar,
how
but
much, like how
almost
much extra
similar.
we should study?
Yes, yes, yes. So the thing is, in case of the part A, we know the structure, right? So we have the orientation, but this time that will go a little bit deeper. Okay. So like in case of part A, we didn't have to go for specific identifications, right? But here we need to go further for
Yeah.
a little bit of identifications of specific things and the surgical relevance things, right? But I say like almost 60% of the things are almost similar from part A in case of the anatomy.
Okay. Thanks.
I have a curiosity regarding the partnership. Actually, I am not habituated to read with a partner in my
Mhm,
life. I
mhm.
actually
Then I will be your partner.
okay, but I was asking that is it mandatory to make a partner?
No, 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 it's not mandatory. See, why I have mentioned that I'll be a partner? Because you need
I
to
will be
give your
very
mock.
glad if you will my partner. It will be very glad. I will be very glad. It's a good
See,
news.
see,
But everyone says that part B is it's
hmm,
not possible with with a partnership. But
it's not
I'm
like that.
I'm I'm too weak at partnership.
It's not like that. It's not like that. It is impossible to overcome the part B without the partnership. It's not like that. See, why I had mentioned that I'm going to be your partner. Trust me, I will be the partner for all of you. Why? How? Because during the live sessions, you are going to communicate with me, right? So I will be teaching you, and also I will be asking you a few questions. You need to give the answers. You need to communicate with me. Also during the mock sessions, I'll be asking, and you are going to like you are going to practice with me in those parts. That's how I will become your partner in general, normally, right? Naturally, I'll becoming your partner, Dr. Alom. Okay. So simply if you
Okay,
follow the
this is
live
it
class,
will be how it
yeah,
will be. This
if
is it.
you're if
Okay,
you're going
okay.
to
So
if you are going to follow
it's
the
very
live
soothing
class,
and relieving to hear that. Okay, thank you.
all right, you're welcome. Any other queries, please? All right. Okay, so I think let me just finally to all of my course candidates. Um, As I have given you the drive access, right? Are you well aware of your drive access? Do you know how to communicate or how to commute within this drive yet? I guess not, right? So let me just show you how you're going to operate or how you're going to work through this drive access things and how this will work, right? And then I'm going to finish it off. Just give me a second. Can you see the screen, everyone?
Yes,
Yes, we
yes,
can.
Vaya.
Okay, so this is the MRCS Part B OSCE January 25 to January 26 folder, right? So once you are going to enter into this folder, you will see this sort of folders are there, right? So see, this is the past course from January 25. This is the last course that we have finished very shortly. This is the May 24, this is the September 24 stage courses. So in each of the folders, if you go inside, you will see like there are class recordings, there are mock recordings, right? So within the class recordings, you can see all the folders has been subdivided: anatomy, critical care, clinical examination, communication, history taking, patho, procedural skills. And if you go inside of these stations, all the class recordings are given, right? So you can see all the previous class recordings if you want to, completely fine. And as I have mentioned, as the hybrid workshop, the clinical examination and the procedural skills videos are given as well. So you can see all the stations has been divided and all the stations are given, how you're going to perform, right? Also, in case of the procedural skills, everything is given. So if you want to see all of those things, it has been pre-given to all of you. Okay, so that's how you're going to organize or how you're going to learn if you want to learn more. Okay, so from tomorrow, what we're going to do, we are going to add a new folder, right? Suppose let's call it new course. June 25. Okay. So from now on, from tomorrow, we are going to upload after each of the live class. I will be uploading the class recordings. Okay, let class recordings here. Okay, the class recordings, and tomorrow we are going to start with anatomy, right? So I'll be uploading just after the live class, the recorded class into this anatomy folder. Okay. So if you are going to miss any class, so simply come here into the new course, June 2025, the class recordings, and then whatever the classes will be, it will be given into those folders. Okay. And just after the mock session, I'll be trying to create another folder called mock recordings, and all the mocks will be given there. Okay. So this is about your class recordings and the mock recordings. If you want to see the study materials, okay, if you don't want to study from the books, you want to study from the online version, so simply go to the study materials and you see there is anatomy, critical care, all the stations, all the everything is given as a PDF, so you can study from those. Okay, everything is given, like the communication, it has been given into separate files as well. So everything is given, so you can study from online as well as from the study materials. Okay. Next one is what can I say? Okay, the routine for our new cycle. So I have already uploaded the routine, the class recordings, the class routine and the mock routines, which we are going to follow from tomorrow. It has already been given, and the IMG recall. So we are collecting the questions, specifically the stations of each of the months, each of the centers, and we are working now on 2025. So once it is done, so I'll be uploading this into the drive as well. So you can have the access to the IMG recalls as well. Okay. So this is about how you're going to navigate through this drive folders. I hope this will be a little bit helpful. This has been organized for all of you. And see, lots of courses has been already been given if you want to practice or if you want to go for overhead to our courses and if you want to learn a little bit more. Okay. All the live classes links of the Zoom meetings that will be given into the course um, Telegram course group, okay, that you have been added. Once you have joined the course, you have been added into the Telegram course group, and that is the only course group we are having. And just before your exam, 1.5 months prior to your exam, you will be added into the quick revision course. So all the live class Zoom link will be provided into the Telegram course group. Remember that, okay? I hope it's clear for all of you how you're going to navigate through the drive access. Yes.
Bhaiya, would you please enlighten us? How does the mock routine work?
How does the mock routine?
Yeah, what would be there? I mean, like
Uh,
after completion of a lecture, what
yes,
will be
suppose,
there in
okay.
the mock
So,
session?
suppose, yes. So suppose like tomorrow we are going to finish our anatomy spine, and after that we are going to finish the anatomy upper limb, right? So you will be given a
Right.
break, okay, fair amount of break, and then after that we are going to have a mock session over the spine and the upper limb, correct? So this
Correct.
mock session will be online mock sessions as well, okay, where I will ask you exactly as the exam like questions, okay, and you need to give the answers in a time frame, okay.
Okay.
This is
Thank
the
you.
online. All right.
Sir, I have a question.
Mm-hmm.
I still don't get the direct link to my email.
Okay. Why
And
not?
I already messaged
You
you in
texted me?
your
Okay. I will recheck.
Instagram
Okay.
account.
Okay. I will recheck.
I'm
And
Dr. Purzawan. Yeah.
okay. I will recheck and I will let you know about that. Okay.
Okay.
All right. So yes, thank you so much for all of your time, for your precise and giving me so much attention
Hello,
and for your
sir.
time. Yes, yes.
Can I call you after the session if possible?
Yes, it's possible, of course, yes.
Okay, thank you.
All right, guys. Thank you so much for joining and have an effective communication with me. I hope all of you will pass the exam very, very smoothly. Okay?